This program is co-powered by Babina Speciality Hospital.
Mayam Krumzari adom na yengbiribasi Impact News ni ay Joyshree Usham na Impact Health Link for a Healthy Manipur program asida taram nokchari. Ngasi ako na puzaragli ba topic asi blood cancer and bone marrow transplant. Hariba hiramasida ni hiramasida ako puwarol thambina ba ngasi akoigi studio da lengthin biriba expert asi miyam da shaktak chage mingoi na padzarbada Dr. Brigadier A.K. Dhar, MD and Fellow Medical Oncology, Tata Memorial Hospital, Mumbai, aduga hauzi American Oncology Institute at Babina Speciality Hospital, Khabaishoy Jail Road, Imphal East Ki, Senior Consultant Medical Oncology and Hemato-Oncology. Aduga Dr. Gi achievements kara panjarabada. Okay, Dr. Ngasigi guest Sigi achievements. Ahan bada Best Medical Oncologist in Delhi NCR in 2014. Honored with Vishesh Seva Medal, the Presidential Award for successfully establishing the BMT unit and state-of-the-art daycare center at Army Hospital RNR, Delhi Cantonment in 2011. Aduga, last but not least, a distinction of performing the first autologous transplant in the Indian history for multiple myeloma in 1993. Dr. Dhar, welcome to the show.
Thank you.
And thank you so much for taking the time to be with us here today. We are really lucky and honored to have such an eminent doctor with us today on this show.
It's my pleasure to have.
Thank you, Doctor. Doctor, we have heard about so many types of cancer, but blood cancer is something very unique and different, and people think that it's not curable and something unfortunate thing. So first of all, we'd like to know what is blood cancer and what are the different types of blood cancer and what are the early signs and symptoms of blood cancer.
Yeah, as you rightly said, that blood cancer is unique in itself because it occurs in all age groups. It happens in children, it occurs in adolescents, and it affects young adults, middle-aged people, and instead of all of this, you have blood cancer in elderly population also.
Okay.
So this is a unique type of a cancer which happens because of the abnormal cells in the blood. They start multiplying, and when they start multiplying, they produce tumor burden inside the body. And these blood cells are not abnormal, these blood cells are not only abnormal, but they are immature also. Immature means that they are not able to perform the normal function of the body. And then when they accumulate inside the body, they cause tumor burden and blood cancer, and they destroy the bone marrow, the spleen, the lymph nodes, and the various parts of the body.
Okay.
So that's what the blood cancer is. Now the second question is, you asked us what is the cause of blood cancer.
What are the early signs and symptoms?
Yeah, early signs and symptoms, if somebody has to monitor, that is that if somebody has got fever, somebody has got sore throat which is not responding to the routine treatment. People should remember that if these symptoms are not responding to the routine treatment, then somebody and doctor should be alert, or people should be alert, and they should start suspecting that the blood cancer is there. Second thing is any kind of abnormal bleeding from any side, suppose bleeding from the gums, bleeding into the skin, or bleeding into the other parts of the body like bleeding per rectum. This is also one of the signs
nose
of
bleeding also.
Nose bleeding also. That is also one of the signs of blood cancer. So people should be very, very clear, and they should be aware that blood cancer can cause all these symptoms, and particularly the doctor should try and catch up blood cancer at the earliest stage and refer it to the cancer center.
Okay, doctor, we have already said blood cancer is unique from other cancer. So how is it unique from other cancer? How is it different from other cancer?
See, blood cancer is unique, first of all, as I've already told you, that it happens in all age groups. Number two, now majority of the blood cancer have got a genetic background. Genetic background means that these blood cancer have got associated chromosomal abnormality. And its association of blood cancer or any cancer with any kind of genetic or chromosomal abnormality is a good news. Why it is a good news? Once we have a genetic abnormality or chromosomal abnormality, we know that we have to hit that particular DNA at that particular place. I'll tell you one example. Now, by telling you example, people will understand that what is this genetic background, what is this chromosomal abnormality. There is a leukemia called acute promyelocytic leukemia, APML. Here the genetic abnormality is between chromosome 15 and chromosome 17.
Okay.
Everybody must be knowing that in body there are 46 groups of chromosome, and in this particular disease the defect occurs between chromosome 15 and chromosome 17. What happens is that one part of chromosome 15 breaks and goes to chromosome 17 and gets attached. So the chromosome 15 gets shorter and chromosome 17 gets longer. So this abnormality creates an abnormal protein in the body, and this abnormal protein produces this acute promyelocytic leukemia. Now in 1992 we got a drug called retinoic acid which reverses this kind of a mechanism. What it does is it again breaks at 17 chromosome and reattaches that portion of DNA or chromosome to chromosome 15. So the process is reversed.
With this new medicine?
With this new medicine. The process is reversed and the blood cancer is cured.
So there was for one type of blood cancer. What are the other types of blood cancer?
See, if you broadly classify cancers, cancers usually we call leukemia. So we should divide it into acute and chronic. Acute means short duration. That means it occurs or onset is very short. That means it occurs in weeks and days.
The symptoms?
Yes, the onset of the disease.
Okay.
The blood cancer arises or blood cancer happens in weeks and days. Chronic is long process. It occurs in months and years. So these are the broad, identify it by doing bone marrow examination, blood test, cytogenetic studies, chromosomal studies and all these things.
And doctor, when we talk about blood, for a layman, blood is just the red blood, but in medical terms there are different types of white blood cell and...
Yes, actually if you see grossly when you see, the blood looks red in color. But the components of this blood are white blood cells, red blood cells, platelets, plasma. These are the 4 components.
So when the cancer happens, where does it attack?
It attacks every component.
All the 4 components.
Like if it affects the RBCs, it causes red blood cell cancer. It affects WBC, it will cause white blood cell cancer. If it affects platelets, it will cause platelet cancer.
Okay.
So everything will be affected, but the commonest is white blood cell cancer.
Okay.
That is the commonest. Red blood cell and platelet cancer we see rarely, but we do see these cancers. But white blood cell cancer is the commonest one.
White blood cell cancer.
Cancer is the commonest.
So, doctor, you have mentioned that it's genetic.
Most of the time, most of the cancer, majority of the cancer now we are detecting. Earlier we did not know why does it happen.
What about particularly this blood cancer? Is it more of genetic or more of environmental?
See, we can say it's associated with the chromosomes.
Okay.
And some of the external environmental factors can cause blood cancer. But chromosomal association of blood cancer with chromosome has become the research, matter of research, and we are seeing and identifying more and more cancer associated with chromosomes. Like I told you, 15, 17, then there is one cancer, 922. These are the types of either translocations, that means breaking from one chromosome, going to another chromosome, or there is deletion, one chromosome gets deleted. There are various kinds of combination. We are identifying it, and when we identify it, we take out the newer and newer drugs for that, and the rate of cure is increasing gradually. Like chronic myeloid leukemia earlier, or acute promyelocytic leukemia earlier, it was thought that is incurable. But since these chromosomal abnormalities, cytogenetic abnormalities have been detected, it has become almost a kind of a curable thing.
Okay. Thank you, doctor. That's very hopeful
Yes.
for us. And then, like, what is the relation between blood cancer and bone marrow? Because today the topic itself is also blood cancer and bone marrow transplant.
Yeah.
So, what is the connection?
See, some of the blood cancer or other solid tumor malignancies, they may require bone marrow transplant at some stage. And if you take the statistics, about 20 to 25% of the cancer, blood cancer, solid tumors like lymphomas, leukemias, myelodysplastic syndromes, bone marrow failure, all these people, around 20 to 25% patient becomes incurable. That means they do not respond to, or they do not respond to
Any
conventional treatment. These are the patients who will require bone marrow transplantation. That means their bone marrow has to be changed and the new marrow has to be placed inside, so that the new cells, they start multiplying, and the old cells, the old cancerous cells, are destroyed, and a new marrow is formed in the body.
Okay,
So next question you will be asking me, what is bone marrow transplantation?
yes, what is bone marrow transplant and how is it different from other kidney or liver transplants?
Yes. See, bone marrow transplantation, for the sake of public understanding, I will not go into too technical thing, because otherwise it's a very, very complex process. But we remember 3 steps. One is, there is a diseased bone marrow which is causing blood cancer or other cancers in the body. What we do is, we destroy this diseased bone marrow, right?
Okay.
How we destroy it? We destroy it by high dose chemotherapy or radiation.
First, you have to destroy the.
We have to destroy, because suppose there is somebody in your house who is not paying you rent, so you have to take him out to place somebody who will give you rent. Similarly,
Okay.
we have to destroy the unhealthy cells. That is number one. Second is, we take healthy marrow or
From a
healthy
donor.
stem cells or healthy graft from a healthy donor who is healthy. So we take it out. This is step number 2. And step number 3 is, we have to infuse this healthy marrow in a person who was diseased, but now his bone marrow has been destroyed.
Okay.
So now there is an empty space inside. So the new marrow will come, and cells will start multiplying, and the patient will become all right.
Okay.
So one is destroy the diseased marrow. Second is take a graft from healthy donor, and third is infuse it into the person who had a diseased marrow, but it has been destroyed.
Okay.
So these are the three
Three
steps.
main steps.
3 main steps.
Otherwise, it will become too technical for us
Yes,
to
yes, yes.
understand.
I don't want to become because then the understanding will be an issue.
Okay, doctor, when we talk about blood cancer, blood is a liquid, so it flows throughout the body. So how do we cure blood cancer by bone marrow transplant?
Yes. So what we do is that the disease is there. First of all, we choose a donor who has got a healthy blood or healthy bone marrow. Now we destroy the diseased bone marrow and take out this stem cell, like stem cell, which is called stem cell graft, and then put this stem cell graft into the patient's body. If you allow me, that I have got a clip,
video clipping, yes.
so that will make the things clearer if it can be run at some stage.
Yes,
so I will make you understand how this process of replacement is done.
So do they have to transplant only one part of the bone marrow, or which part of the bone marrow? That's
the entire body bone marrow is destroyed.
It has to be destroyed entire.
Because, and you must understand that bone marrow is running in every bone. So
of the body.
Yes. You have to destroy that marrow. When you destroy the marrow, the patient's immunity becomes zero.
So then how do we keep the patient alive at that time?
At that stage, we keep the patients into bacteria-free, viral-free environment in an isolated room, which is fitted with HEPA filters.
Okay.
HEPA filter is the filter where the air, even the air is filtered without bacteria and viruses to the tune of 0.01 micron.
So all these facilities there at Babina Specialty?
We are going to develop this facility. Okay. I have already done it in my at least at established unit at 7-8 places. So we will be establishing soon at Babina Hospital. And then the patient is kept in that isolated room for about 14 to 21 days.
In that condition?
Till the new marrow grafting takes place.
So it's a very complicated process.
It's a very, very complicated. It looks very simple from outside, but it's a very, very complicated. It's a human body. And the question you asked me, that how it is different, it's a very, very intelligent question, that how it is different from kidney and liver transplantation. See, bone marrow transplant is not like a solid organ transplant. It is different from solid organ transplant is that nothing is removed from the donor.
Nothing is removed, but liquid?
Yeah. See, like we removed kidney from a donor.
Yes.
We remove part of liver or liver from donor in liver transplantation. But here in bone marrow transplantation, what we do is we take out only the stem cells from the blood of donor. Now, what is this stem cells? It is like blood only.
Okay.
So if you allow me and if you run me that video.
That video, yes.
So you will be clear that what is stem cells and why I am saying that nothing is removed. Because no major surgical procedure is required. The donor comes, we take out the stem cells and allow him go home the same day. He is not put into anesthesia, he is not hospitalized, he is not given antibiotics, no scar is there, no mark is there, no knife is put on him. So
there is no risk for the donor?
There is no risk for the donor.
Okay.
0% risk. So that's how it is different from kidney and liver transplantation.
Thank you so much, doctor. Now we'll come back to who can donate this bone marrow. But before that, we'll take a small commercial break. Thank you. Matang Shwaida Atinba commercial break talawjage break matung da Dr. Ga blood cancer amasung bone marrow transplant matang da amuka hana khangmina kishi.
Notice the ahanba oina RBI na regulate toba amasung Ministry of Finance, Department of Financial Services, Government of India na Surface 2002 gi makada financial institution ama oina sakhangkraba Pradhan Mantri Awas Yojana Housing for All misang gi makada subsidized home loan pibada mangjil thariba Panthoibi Housing Finance Company Limited amadi masigi sister company singi Guwahati yauna branch tarahumdoi hangdokchare chahi tara-taret ki khongchata lakraba Panthoibi Housing Finance Company Limited tagi miyamna financial facility sing lawirana ningsingjari Panthoibi Housing Finance Company Limited and its sisters companies Uripok Taurambam Laikai.
This program is co-powered by Babina Speciality Hospital.
Break matungda amuka hana taram nokchari. Doctor, you said anybody can. There is no risk for the donor.
Yes.
So, but who are those healthy donors who can give this bone marrow?
There is a WHO criteria for that, and now ICMR, Indian Council of Medical Research, has also developed guidelines for bone marrow transplantation. Basically, these guidelines is to streamline the process of transplantation happening all over the country. Now, the donor can be a person whose age is less than 50 years.
Less than 50 years.
Less than 50 years. Should be without any comorbid conditions. Comorbid condition like disease, heart attack, cirrhosis, or that person should not have cancer himself. That is also issue.
Very important.
That's very, because instead of taking healthy cells, we will take the cancerous cells from him. And number 3 is that person should match with
the blood group.
No, blood group is not important. It should be HLA matching of donor and recipient.
Okay.
Now these HLA matched patients are taken for bone marrow transplantation. But now the problem is that searching for a matched donor, HLA matched donor, because I cannot match you or you cannot match me. If you screen 1 lakh people, you will get 1 matched donor. So it's not possible to screen 1 lakh people. So what we have done is now that besides matched donor transplantation, we have started taking partially matched donors also. Partially means now I'll give you numbers by which it will be easy to understand. In HLA there are 10 loci, 10 different dots you can understand. Ideally these 10 loci should match from donor to recipient. 10 out of 10 should be the ideal. But now since there is shortage of donor, matched donor is not available. So now the technology has gone ahead and we started taking even partially matched, maybe 7 out of 10, 6 out of 10, 8 out of 10. And we have gone further ahead. We are taking 50% matched donor from father to child or child to parents. That is called haploidentical transplantation.
Okay.
So we are developing technology so that we are increasing the chances of matching in bone marrow transplantation. But ideally, if somebody asks you that who should be the ideal donor, it should be HLA 100% matched.
Below 50 years.
Below 50 years of age with no disease, no comorbid conditions. So that should be the ideal.
Okay. Doctor, in the beginning you have mentioned that some type of blood cancer can be cured by medicine.
Yes.
While the rest has to undergo through this bone marrow transplantation.
Yes.
So what is the current status of bone marrow transplantation in India?
Yes. See, I'll take 25-30 seconds before I come to your question. The first bone marrow transplantation was performed in world properly in 1969. And we are proud to say that we did transplantation, bone marrow transplantation in 1983 in India.
83 in India.
Yeah, that is 14 years after. That is a very good achievement. And my guru, my teacher, Dr. Advani, from whom I learned bone marrow transplantation, he was the person who performed the first bone marrow transplantation in 1983. So this is the background history. Now the status is that we are doing quite a number of transplantation. A lot of centers have developed, but there is still shortage of centers in India. Why it is so? Because These all centers are located in Tier 1 cities, metro cities. People have not gone peripheral area to establish these bone marrow transplant centers. I think northeast, I do not know whether somebody
Manipur
is doing or not.
First.
And Imphal or Manipur, there is no bone marrow transplant center. So this is the reason I have come here to establish a bone marrow transplant center, because we will be able to save quite a number of patients when they become treatmentless. And when you go to the Tier 1 city, metro cities, the cost is there, the waiting list is there, the logistic problems are there. So why not to have our own center in Imphal, which will look after the Manipur as well as the adjoining states.
That's a very good initiative,
Yes.
Doctor, and
Yes.
I hope it comes up very soon.
Oh, definitely it will come, because I have already established, I told you, 7 to 8 centers in India, ranging from periphery also to metro cities also.
So, Doctor, this bone marrow transplantation, this is useful not only for curing blood cancer but any type of disease, right?
There are number of diseases. There are immune deficiency diseases. There are myelofibrosis. There are bone marrow failures, neurological diseases. Now this bone marrow transplant, exactly, this is an old name. Now it is converted into stem cell therapy.
Stem cell therapy.
Stem cell therapy, because it has cured some neurological disorders also. In Army Hospital RNR, where I was there, we used to treat some of the heart patient also with stem cell therapy. So there are so many disorders, possibilities and treatment. But ICMR has published a guidelines to sort of avoid misconception and avoid malpractices. They have given that these are the diseases has to be treated by stem cell therapy, and every year they keep on edit the disease depending on the experience of people.
So then this is a very modern and latest or advanced kind of therapy. It must be very costly also. So
Yeah, it is costly. It depends on us how costly we want to make it. See, when I was in Army Hospital, I used to do transplants within 3 to 4 lakhs of rupees. But moment I came to the corporate sector, it jumped to 15 lakhs of rupees. So we see, what I mean to say is that we should run a program which should be affordable to the public, not a profit-making program. It should be, patient should be able to afford this facility.
Okay. And Doctor, regarding blood cancer, Doctor, you said that it's mostly curable.
Some of the blood cancers have become curable,
But others are not curable.
Blood cancers in the elderly population, elderly people, are difficult to treat, but yes, we are trying to find out the treatment for these people also.
For other cancer, we have different stages, stage 1, 2, 3, 4. For blood cancer, is there anything like staging?
Blood cancer we cannot stage, because once we detect the blood cancer, it's already in the blood, whole of the blood is involved. It is not that blood in the head and neck will be affected or shoulder will be affected, no. It is circulating all over the body, it is in the bone marrow, so we do not stage it.
Okay. Thank you so much, Doctor. Now I would like to ask you more questions, but we have come at the end of the program.
Yeah.
And once again, thank you so much for coming here in our studio and explaining all these things, as well as for setting up the bone marrow transplant unit at Babina Specialty. I hope it comes up soon and becomes successful. Thank you so much, Doctor, once again for your time.
Give a very positive news to you.
Thank you. Ngasigi Impact News ki Impact Health for a Healthy Manipur program si matang aswai loslakli matang episode ta atopa laina amagi matang da puduna lakjage haraga miyam dagi kaina ba yathang ni jari. Thank you.
Biraksi, Lengshin Biraksi, Prime Medicosta. Lejare, Makal Kudingma ki hidakta, Yamdrabada Chada Taradagi Yankai Fawo discount Pizari, Thagi Liptana Chabiri Basingi Oina Shu, Ahen Bakana Ba Pijari. Loina na Prime Medicos Pu, Atopa Mioi Amada, refer Toba Kudingi, Lupa Chama Famiduna, Kanaba Asi Lobiu. Akupa Marol Kambining Basingna, Makada Pizari ba number Asida, contact Tobira Payagani, 700